Welcome to Total Gold, our most biologically, technically advanced, and most comprehensive formula produced to date from the Vet Gold laboratories. Why Total Gold? Manufacturers in the nutraceutical space prefer clients to purchase multiple different supplements to cover all your horse's needs. This complicates feeding and increases the risk of potential binding between supplements and is obviously not cost effective. Hence the demand and need for a one-stop shop. Total Gold is the result of an overwhelming client request demand for a product that encapsulated all of their horses' needs. We combined the proven clinical effects of hoof gold, coat gold, and bone gold into one, and then added a complete spectrum of vitamins, minerals, and amino acids. Finally, we have the solution to market demand, a perfect one-stop shop. So the big question is, what's the difference between our products and everyone else's, apart from the patent formulations? Well, it's clinical caseload and subsequent data. At VetGold, we pride ourselves at assimilating data from as many clinical and radiological cases as possible. Because as a veterinary surgeon myself, evidence is crucial. I'll run through a few of our case reports where our supplements have shown some very interesting clinical results. More can be found on our webpage under the About Us tab. This particular case was a 3-year-old thoroughbred filly presenting with persistent right front lameness post-gallop. Filly was positive to testers on the right front with a mild digital pulse. On the 26th of August, radiographs were taken of the right front foot. Large P3 type 4 solar margin fracture is evident on the medial aspect of the toe, 32.6 millimeters by 4.1 millimeters, with approximately 1.4 millimeters of separation from the parent bone, as seen here. The horse was shod immediately and placed on 3 scoops of bone gold fed once daily. This is the radiograph taken on the 26th of August here on the left. We can see this fragment here. And then on the 21st of August on the right-hand side here, 8 weeks post-injury. A fine residual line is still evident, but we've got approximately 90% resolution, 8 weeks post-injury. So here we have on the 26th of August the original fracture line, and this is now 12 weeks post-injury. You can see the fracture here is fully resolved. We come across a lot of these. They present with diffuse intermittent hoof pain and are often undiagnosed. These fractures are a common cause of poor performance in racing or any equine sport. Thoroughbreds are now experienced with the worst offenders. Type 4 fractures have a globally recognised 7 to 9 month recovery period. In this case, the horse is able to return to work at 12 weeks, 3 months. So less than half the anticipated healing time. Here's another case. This colt was examined on the 15th of October and observed 3 out of 5 persistently lame left front 1 week post-race with an elevated pulse and sensitive testers around the entire solar circumference. The colt blocked sound to a low point block to the left front on the 15th of October when this radiograph was taken. Of note, both the wall and sole integrity was poor and brittle with low heels, and the solar surface was partially convex, not concave. 2 large P3 solar margin fractures can be identified on the medial and the lateral peripheral margins, the quadrants of the left front. The lateral fracture measures 4.8 centimeters in length, and the medial fracture measures 3.6 centimeters in length. The horse was immediately shod and placed on 3 scoops, fed once daily of bone gold. The horse was sound on re-examination on the 28th of December, 10 weeks later. Both the medial and lateral solar margin fractures, as you can see here, show 90% resolution. You can still see a faint line on this lateral aspect. Interesting, lateral radiographs taken simultaneously on the 28th of December show the sole depth had simultaneously increased from 4.1 millimeters to 9.3 millimeters. And in a 10-week period, no sensitivity testers. Again, of note, fractures of this severity normally require 7 to 9 months. For this, we had a 10-week resolution period. In another case, this is a valuable yearling colt that had suffered blunt trauma injuries to the dorsal right hind proximal canter. You can see the fractures here. This is the radiograph of the initial injury on day 1, April 14th. Initial April radiographs show a 44 millimeter longitudinal displaced fragment. fracture, right mid-cannon, 5.5 millimeters in depth, mid-dorsal cortex associated approximately with a 27 millimeter by 6.5 millimeter secondary fracture here. Initially, surgical removal was recommended of the fracture fragments. However, a decision was made to closely monitor and radiograph monthly. The colt was placed in box rest and initiated 3 by scoops once per day of bone gold. Second series of radiographs was taken on the 17th of May, 4 weeks later. We can see here a massive change. Both fractures have attached and integrated with the parent bone, and minor surface and thesiophyte formation periosteal activity is evident. So here we have 8 weeks post-injury, the original radiographs, and then 8 weeks post-fracture. So the resolution of the cortical fractures of this size without surgical intervention is unexpected. Fracture fragment removal is historically required, as largely distracted fracture fragments such as these often develop into sequestrum. Total resolution in 12 weeks was highly unexpected. This filly showed a mild bilateral shifting lameness with bilateral digital pulse and positive to testers. This is her left front on the 10th of January, and not surprisingly sensitive around the solar margin. Large type 4 solar margin fractures can be identified both medially and laterally. This is her right front on the 10th of January at the time of initial inspection. Also not surprisingly sensitive around the solar margin periphery to testers. Type 4 solar margin fractures can be identified both medially and laterally. Quite clearly can be seen here. The filly was remedially shod and started both bone gold 3 scoops once per day. This is 7 weeks later. This is on the 29th of February. This is the left front foot. So the dorsoventral radiographs on the 29th of Feb show considerable resolution of the type 4 solar margin fractures evident medially and laterally that were evident on the 10th of January. One medial fracture still remains, as indicated. This is her right front foot. So the dorsoventral views show again significant resolution of both medial and lateral fragments. An additional fracture can be identified medially here. This is Penny, another interesting case. A 14-year-old stock horse mare suffering chronic Queensland itch. On the 16th of September, Penny was brought to our clinic and she suffered chronic Queensland itch for years with multiple unsuccessful topical and systemic treatments that had been non-responsive. The only change to Penny's case management was 3 scoops of total gold fed once daily. This is now the 18th of December. This is Penny approximately 12 weeks later. So here's the comparison. A re-examination of the mare showed considerable resolution of all associated lesions as per the tail photographs. The subdermal infection had resolved with significant follicular regrowth over the tail base, rump and neck and face. The mare has gained weight, appeared to be comfortable, and the seborrheic smell had dissipated. To reiterate, the only change to the mare's management program was the addition of 3 scoops of total gold fed once per day. So this is a label on the top of the bucket. Directions are important as they are weight dependent. As you can see, there are 3 clearly demarcated weight categories. Do not split the doses. Add an additional scoop for clinical or pathological conditions. For instance, if you have a 500-kilo horse, it falls into the 2 scoops per day category. If you have a clinical superimposed condition, such as a fractured hoof, add another scoop, so you're now at 3 scoops once per day for a 500-kilo horse. QR codes, point of difference. It's a nice reference back to the web page for more interesting clinical cases and radiological results. Please call for any questions.